There's so much pushback that I see. I even find editors don't be so pro keto. So my question for you is, what are your thoughts
Yeah, we study ketogenic diets and ketone metabolic therapy. That's why I call it ketone metabolic therapy, because funding agencies don't even want to fund you if you're
Yeah.
following a ketogenic diet, because there's a lot of baggage with
Yeah.
the diet. So it gets over promoted, it gets misunderstood, and I think it gets sensationalized in many different ways. There's low carb, there's internet keto, and the ketogenic diet that we study is a prescriptive metabolic therapy, which means that a neurologist working with a registered dietitian will prescribe a diet to a patient, and it'll be carefully calculated to change their metabolic physiology to then metabolically manage epilepsy and other seizure disorders and other things that we're studying now. I'm working with Moffitt Cancer Center, and we're creating ketone metabolic therapies to enhance immune checkpoint inhibitors, which are the new class of immune therapies. With checkpoint inhibitors, a very carefully calculated ketone metabolic therapy that will enhance the adaptive immune system to make the checkpoint inhibitor work better. There's no other diet that does that. So it's a very calculated diet. Patients will be wearing continuous ketone monitors so we can put them into a therapeutic range and then titrate the diet or supplements to achieve and maintain that therapeutic range. What we're studying and what we're talking about here in the context of university research is a prescriptive metabolic therapy. That's not to say that a ketogenic diet can't have benefits for the everyday person, for weight loss, for glycemic control, things like that. But I think a simple low carb diet, just eating 100 grams of fibrous carbs, vegetables and fruits, and steering away from processed grains and processed food in general, can do 80 to 90% of what people want keto to do. And it's a non-ketogenic low carb diet. I think there needs to be an appreciation for that. But when people go low carb, they say, I went keto, and maybe had a bad experience with it because a lot of people, I can tell you, just cannot tolerate the high fat. And like me, it actually increased my ApoB and my LDL. I do follow a very low carb diet that's ketogenic. That's maybe 50 to some days 100 grams of carbs, but it puts me in a low state of ketosis. But it did increase my LDL, but I have a specific mutation where I hyperabsorb cholesterol. So there are problems with ketogenic diets. And the problem that I mentioned is probably the most talked about problem, the elevation of LDL and ApoB. I'm finding quite a few people there's about 4 or 5 different mutations that can make you a hyper absorber of cholesterol. Truly, I think like a low carb Mediterranean diet would probably be a good default diet for people to steer towards, away from a standard American diet, and eat the amount of carbohydrate based on your activity levels. Some people thrive off carbohydrates, and I can't argue with them if they're eating a high carb diet and their metabolic biomarkers look great. However, as we age, our ability to tolerate the same amount of carbohydrates we did when we were in our 20s and 30s